FAST and eFAST, focus assessment with sonography in trauma, and extended focused assessment with sonography in trauma. Good day, I'm Dr. Siko from Mzantsi Medics, and today I'm going to be discussing FAST and eFAST, an important topic in the emergency department or the trauma department. For a downloadable PDF version of this lecture, visit mzantsimedics.org. On the Mzantsi Medics website, there's also a self-test that is available where a person can go and look at the test to check their knowledge after watching the video or reading through the PDF document. This picture shows two ultrasound probes that are mainly used in FAST and eFAST, but we'll discuss this at a later stage. Mzantsi Africa suffers from a high burden of trauma patients, either due to crime-related injuries, accidents, or motor vehicle accidents. These trauma patients then present at various emergency departments across Mzantsi Africa. They present in the form of blunt or penetrating injuries, or a combination of both elements. However, when there is suspicion of occult bleeding into the abdomen or thorax, it is often difficult to make this diagnosis on physical examination alone. And now, this is where FAST and eFAST come in. In the emergency department, further investigations are usually necessary in order to make the diagnosis of occult bleeding. In most centers, computed tomography is considered the gold standard for diagnosing occult bleeding, especially in the abdomen. But however, we know that CT has its challenges. Diagnostic peritoneal lavage is another option for helping to make a diagnosis of hemoperitoneum, but due to its invasive nature, it is being largely replaced by FAST in most emergency departments. FAST may identify free fluid in the peritoneum, pleura, and pericardium. In most trauma departments or emergency departments, it is the integral part of the initial stabilization and resuscitation of trauma patients. According to the ATLS course, according to the ATLS manual, the 10th edition, it is recommended as an adjunct to the primary survey of the trauma patient. The Emergency Medicine Society of South Africa in 2021 provided guidelines as to how FAST should be used. This is a picture of primary survey with simultaneous resuscitation, and it is showing how FAST is part of the integral part of the initial stabilization and resuscitation of a trauma patient. In this video, we're going to be focusing on the definition of FAST and eFAST, differences between FAST and eFAST, indications for FAST and eFAST, advantages of FAST, and the disadvantages of FAST. Let us briefly look at the definition of FAST and eFAST. As we've already mentioned, FAST is a focus assessment with sonography in trauma. It is a bedside ultrasound tool used to screen for occult bleeding in the abdomen. It is also regarded as a point-of-care ultrasound in most emergency departments, and it can be performed by the bedside. To take note that FAST is only referring to the abdomen. eFAST, on the other hand, is extended focus assessment with sonography in trauma and adds the anterior and lateral pleural spaces and the pericardium to the traditional FAST examination. Let us just briefly compare FAST and eFAST. FAST was the original screening tool that intended to find free fluid in the abdomen after trauma. It only looked at three views, that is the right upper quadrant, left upper quadrant, and the pelvis. Extended FAST, which was introduced later, included lungs and the heart in addition to the traditional FAST. This table briefly summarizes and compares FAST to eFAST. It can also be found on the Mzantsi Medic's website. Now let us look at the indications for FAST and eFAST. Remember, occult bleeding, and occult bleeding. FAST is indicated in situations where intra-abdominal and intrathoracic hemorrhage is suspected but cannot be excluded by physical examination alone. Examples would include peritoneal bleeding in penetrating injuries, pericardial tamponade in penetrating injuries, occult bleeding in abdominal and thoracic trauma, pneumothorax or hemothorax. FAST is sometimes performed in order to assist with the decision making when the patient would require definitive surgical management. FAST is also indicated in patients who are in shock and are not responding to resuscitation attempts. This picture shows the broad indications for FAST and eFAST. What are the contraindications? There are no absolute contraindications for FAST. FAST is usually contraindicated in an emergency situation which obviously needs surgical intervention, and that surgical intervention is going to be delayed by the performance of a FAST. Let us look at some of the advantages of FAST. As we've already established, FAST is a point-of-care ultrasound tool that is available by the bedside. Therefore, the patient does not need to be moved or transported from the emergency department. Any personnel that is trained in FAST can perform FAST. FAST also allows early determinations with regard to definitive surgical management. It is a non-invasive procedure as compared to DPL. It can be performed rapidly. Already mentioned, it is the adjunct to the primary survey. It's safe for pregnant and pediatric patients. It results in reduced performance of CT scans and diagnostic peritoneal lavage examinations. No radiation to the patient. Repeated examinations may be performed without concern of radiation exposure. Of course, it is cheaper than a CT scan. However, where there are advantages, there must be disadvantages. FAST is obviously operator dependent. In situations where there is bowel gas and subcutaneous air, there might be poor visualization of images. A large BMI can distort the images. There is chance of missing diaphragmatic injuries, bowel injuries, and pancreatic injuries. FAST does not assess retroperitoneal organs. It does not visualize extraluminal air, and also FAST does not localize the source of the bleeding or the source of the free fluid. As we have already mentioned, FAST examines 5 major areas. That is the perihepatic fossa, perisplenic fossa, peritoneum, pericardium, and the lungs. This is a diagram showing the areas that are examined by FAST. 2 ultrasound examinations are used for FAST. The curvilinear probe and the phased array probe, also known as the cardiac probe. Let us look at the curvilinear probe. It is a low frequency probe with 2 to 5 megahertz. The curvilinear probe has a broad base footprint and is recommended for mainly abdominal and pelvic examinations. The phased array probe has got a low frequency between 1 to 5 megahertz. It is recommended for abdominal examinations, pelvic examinations, and thoracic examinations for pericardium and the lung. This is due to its narrow base and it can fit in between the rib spaces. What are my recommendations? I recommend that MOs, medical officers working in emergency department in Mzantsi, Africa, should be trained in FAST, eFAST, or point of care ultrasound, especially emergency care point of care ultrasound. Emergency care practitioners and other pre-hospital personnel should be trained in FAST, eFAST, or emergency care point of care ultrasound. Other healthcare practitioners also working in the emergency department should be also considered for these courses. Healthcare providers should familiarize themselves with their local guidelines and protocols pertaining to point of care ultrasound. These are the references that we used to summarize this topic. Feel free to look up of any of them. Thank you for taking time to watch this video. If you liked it, please press the like button, share with your colleagues and friends, subscribe if you would like to see more content, or feel free to leave a comment down below. Once again, I thank you.